you so much for joining us. Did you know that about 1 in 20 Americans suffer from hemorrhoids? That's right. This common condition affects millions of people every day. Hemorrhoids are swollen veins in the rectum or anus that can cause pain, itching, and bleeding. And they can be caused by straining during bowel movements, pregnancy, or sitting for long periods. So while it's a topic many finds embarrassing to discuss, we're here to break that stigma. And hemorrhoids are a normal part of human anatomy, and there's no shame in seeking relief. And they can get very uncomfortable too. So that's why we're so glad to be chatting on IG Live today with Dr. Carmen Fong. Dr. Fong is the co-medical director of the Hemorrhoid Center of America and a double board certified general and colorectal surgeon. So during this live, we are going to discuss common causes of hemorrhoids, hemorrhoids prevention, and non-invasive and surgical options for removing hemorrhoids. So I'm gonna say. Hello, hi, Dr. Fong.
Hi, Dr. Hua. How are you?
I'm good. Please call me Jenna.
Please call me Jenna. Call me.
Thank you so much for taking the time. I know you are extremely busy.
Of course.
Please tell us a little bit about yourself and how you became a double board certified general and colorectal surgeon.
Sure, yeah. So I'll give you like the 30-second spiel, which is that I was born in Hong Kong. My family's from Hong Kong. We immigrated to Canada when I was like 5 years old. My dad was an expat for Colgate-Palmolive. And then after that, I went to school in New York. Went back to Hong Kong for high school. Went to Sarah Lawrence College in New York for college, and then I ended up coaching volleyball for a few years. So then I ended up doing medical school at Michigan, so Michigan State University. Go Green, Spartans. So then I went to medical school, and after medical school, I decided I wanted to be a surgeon. And honestly, my parents wanted me to be a plastic surgeon, or something something more glamorous, and useful, for all my aunts. But I really fell in love with the abdomen, and I fell in love with doing, colon resections and colon surgery. And then, so after general surgery, I did a fellowship in colon and rectal surgery, and that's how I'm here.
Wow, amazing. I also find the abdomen is a lot more interesting than, plastic surgery.
Yeah, no knocking on some of my best friends are plastic surgeons, and it's like fascinating. So I actually have an art degree for an undergrad, and so I love, the aesthetics of things, and I like things to look pretty. But now all I do is I make buttholes look pretty.
That's So what's the difference? A lot of people don't know, like, what's the difference between colorectal surgeon and a gastroenterologist?
Yes, super common question. So a colorectal surgeon is a 1-year fellowship on top of a 5-year general surgery residency, and GI, gastroenterology, tends to be a 3-year fellowship on top of a 3-year internal medicine residency. And so when you're done with medical school, you do this like divergent path into either medicine or surgery. And so gastroenterology is a medical field, a medicine field, and colorectal surgery is a surgery field. There's a lot of overlap in terms of the pathologies that we, look at. So, abdominal pain, diverticulosis, IBD, like inflammatory bowel diseases, and then obviously like hemorrhoids. We actually both do colonoscopies, and obviously some GIs do very advanced colonoscopic, endoscopic procedures. But colorectal surgeons do the actual surgeries. So we do like the abdomen surgeries, the anal rectal surgeries. Yeah, that's the main difference.
Okay. The top of the live, I can explain a little bit like what is hemorrhoids, but could you explain to our viewers like what they are?
Yeah, of course. So hemorrhoids are three little bundles of blood vessels that occur in everybody. So everybody's born with them. They look kind of like this. If this was your anus, this is the right anterior, posterior, and the left lateral. And they serve a couple of actual useful functions. So they cushion the anus most of the time so that stools can pass through more easily. And then they also form about 10 to 15% of the anal continence. So helping to keep things inside. And then lastly, there's a little bit of lubrication that the hemorrhoids do. So everybody has them. What is the problem is it was when they become symptomatic, which is, they start to have problems. The most common problems that we see are internal hemorrhoids that bleed, or swell, or they cause like itching, burning, or kind of like, almost like a pressure sensation. And then the second most common thing is if we see external hemorrhoids that are thrombosed. So a little blueberry or a little blood clot on the outside, which is extremely painful, but those tend to not bleed.
Okay, you just answered my next question, the difference between the internal and the external hemorrhoids.
Yeah.
So, like, what are some common causes of hemorrhoids, especially when they become a problem? Because we know now they're actually you're born with them.
Yeah. Um, just another note about the internal and the external though, is internals are above the level of the sensory nerve, so above the dentate line. So I always tell people, internal hemorrhoids tend to be painless bleeding, and external hemorrhoids, because they're on the skin where the sensory nerves are, they tend to be pain without bleeding. And when we do internal and hemorrhoid procedures, and I think you have a question about this later on, they're not as painful as so much as like you feel pressure and discomfort, but if we have to do anything like external, it tends to hurt. Now, cause-wise, there are quite a few, and I think you discussed them at the top of the live too. But the most common things are straining. So straining on the toilet. So my rule is usually sit for 2 to 5 minutes on the toilet max. If you're sitting there for 20 minutes reading your phone, don't do that or else you're coming to see me. So 2 to 5 minutes max in the toilet. Long plane rides, long car rides, like so any amount of sitting, and then obviously so constipation, but diarrhea can also cause hemorrhoidal symptoms. So going too frequently, wiping too frequently can cause some irritation as well. And then obviously pregnancy and childbirth because of the increase intra-abdominal pressure, literally pushing everything out. The one kind of uncommon one that's not in textbooks, but I've seen a lot recently, is with people very focused on, healthy eating, diet, and exercise, which is great. People who are doing a lot of lower body workouts and cycling. And so cycling on a Peloton for long periods of time can really cause hemorrhoids and fissures. And like squats, so heavy lower body lifting, that tends to make the hemorrhoids pop out a little bit too. We can obviously treat those so that they don't become a problem in the future, but it's a uncommon, but maybe recently more common one.
Oh, wow, that's super interesting. But everyone needs to remember only 2 to 5 minutes because I think a lot of people don't fall in that category.
100%. We all were learning how to potty when we were potty trained. We were like, okay, we have to sit here till we poop. And that's totally the wrong way to do it. And in fact, I talk about that in my book that, we do potty training all wrong. Um, 20 minutes on the phone. They used to have an old saying, like my mentor said, keep your library out of the toilet because people would read books. And now I'm like, just keep your phone out of the bathroom. Don't bring your phone in there.
I lit-
Don't play.
literally had I literally had a housemate before that had even like a little stool looking thing to lift his legs so he can sit on the toilet longer to prevent the numbing the sleeping leg. But then it's like, oh my god, that's so wrong. Like think about your hemorrhoid.
It's so funny because yeah, one of the examples is like a squatty potty, which is technically supposed to change the anal rectal angle and does make pooping a little bit easier in some people. So if your anatomy needs that kind of boost, most people actually don't need it. And you're right, it elevates the legs so that you're not getting the two numb legs afterwards, and then it just makes you sit there for longer. So probably not great.
So what are some things we can do to prevent hemorrhoids besides, don't sit on the toilet
Yeah.
too long?
Yeah. I mean, I always fiber, and so one of the things is, everybody's always like, oh, fiber, what's fiber? How much of it do I need? So my rule is 25 to 35 grams of soluble and non-soluble fiber. Because, you can get, Metamucil, which is like, like a little bottle powder in a capsule. Now they come in gummies, but those tend to only be like 5 grams of fiber. So if you're like, oh, I take a Metamucil every day, why don't I poop every day? That's usually not enough. You have to have, my rule is, or I tell patients fruits and vegetables at every meal is like the easiest way to remember it. So apples and oatmeal for breakfast, some kind of salad, with beans for lunch, and then for dinner, some kind of cooked vegetable and then a fruit. And you're usually okay. And if you need to do the 5 milligrams of supplement on top of that, then you'll get there. So 25 to 35 grams of fiber. 8 glasses of water a day, which I think is hard for a lot of people, especially when we're working all day and we're running around and we don't want to be like drinking water and peeing the whole time. So I tell people, set your Apple Watch, every hour or so, get up, walk around for 5 to 10 minutes, and have a glass of water. When they used to have water coolers, like that would be what people did. Um, so water and then exercise, but not too much exercise. So everything in moderation. Too much exercise will actually make you go the other way and actually result in some dehydration and constipation. But even just like the regular, recommended amount of like 30 minutes 3 times a week, it stimulates GI motility and does help you go better and prevent hemorrhoids. And then last but not least, not sitting for too long, right? Not even just the toilet, but not sitting for too long. Um, a lot of people got hemorrhoids and they got worse during the pandemic because everyone sat around for 8 hours a day working from home. And so literally all that blood pools in your anus and people are like, why are my hemorrhoids worse? Well, you're sitting 8 hours a
No, duh.
day. Yeah, I know. It seems obvious now, but back then we were like, oh my God, we're seeing more hemorrhoids.
That's interesting. Now let's talk about treatment. So could you talk about like non-invasive treatments for hemorrhoid?
Yeah. So, there's a lot of things we can do for hemorrhoids, and we're trained, to do like 8 different things depending on what the person needs, but there's a couple that are evidence-based to be like the best solution. The most common one that I do is actually rubber banding or hemorrhoid ligation. So literally you take a little rubber band and for internal hemorrhoids, you can fire the rubber band goes like this. It goes over the hemorrhoid in about 20 seconds and it squeezes it off in the next 2 or 3 days. And again, because it's above the level of the sensory nerves, it doesn't really hurt. It's more of a pinch and then you feel pressure. It feels like you have to poop for a few days until that squeezes, it falls off, the rubber band goes with it and gets mixed in with the stool and washed away. I have had patients, obviously, people will be like, oh, I did have it hurt. Sometimes people, I think, in thin people, it tends to be a little more painful because there's less tissue to grab. If that band pops off prematurely, it can cause a little bit of an ulcer, which hurts a little bit, but usually I've seen it like up to a week where it hurts and bleeds a little more than it should. And then after that it heals and that hemorrhoid is gone. Uh, those are the two main ones. Now, the other non-invasive things, laser or infrared coagulation, which is not proven to be as effective as hemorrhoid banding, and it does hurt a little more because literally you're actually just like lasering the vessel, and that is one option. Phenol injection, which is injecting a sclerosing solution right into the hemorrhoid. This tends to be better for like old people who can't tolerate a banding, people who have immune compromise, who have wound healing issues. Um, and, uh and the 2 surgical options are THD, which is transanal hemorrhoidal dearterialization, which is a procedure where I just go in and using a Doppler or an ultrasound, find all 6 of the vessels that lead into the hemorrhoids, and I sew them up. And then so there's no cutting, but there is some sewing. The stitches are dissolvable. They dissolve in 6 to 8 weeks, and, it works really well. So it works best in people who have bleeding and prolapse symptoms. And then last but not least is the, gold standard excisional hemorrhoidectomy, which is the surgery that everybody fears. Um, because it is painful. Like of all the surgeries I do, it's probably the most, painful one. And I used to do like big abdominal colorectal surgeries, but that's on your belly and your nerves on your belly are not as sensitive as the nerves on your butt. And yeah, so excisional hemorrhoidectomy usually remove 2 or 3 columns, cut them all off, and then sew them up. I tell people the recovery time is an average of 2 weeks, but I've seen patients who were like, "Oh, it only hurt for like, 36 hours," and I've had patients who are like, "It hurt for 8 weeks."
Ouch.
So it pretty yeah, I know. It pretty much varies between how extensive your surgery is and what your pain tolerance is. But it works. The recurrence for excision is about 8 to 12%. So it is technically the best surgery to do.
So then how do we prevent people from getting hemorrhoid returning, get it back? Like, especially nutrition wise, besides like fiber.
Right. Yeah. So I would say that technically fiber is the best thing. The other thing I would throw in there is probiotics. Probiotics, while there's been like some hit or miss data about it, I think there's increasing data that having the right strains and like,
Mhm.
a good mix of strains is useful for the gut microbiome. Obviously this is right up your alley too. But probiotics help with the frequency of bowel movement so that you're, trying to go every day and regulate your GI system to do that, in addition to the consistency, which is what the fiber controls.
Yeah, we also often tell people, get it tested before you take a prebiotic
Yes.
as or probiotic. You also don't want to mess up your colonies and then adding too much of each thing that might not be as good either.
Yeah, no, 100%. And I'm also I think this is gonna be like a, evolving area of research, but I'm pretty convinced that people in well, and we know this, that people in different regions have different
Mhm.
microbiome, but I think that people who are like in completely different countries, for example, like I was born in Hong Kong, and I think that my microbiome is gonna be different from somebody who's here,
Oh yeah,
who was raised
for
here.
for sure,
Yeah.
for sure.
Yeah.
Another topic I know we didn't include in today's preparation is the fecal transplant, because I think that's also a really interesting topic. And then it kind of echoes with, uh, where you were born or where you grew up or like who you're living with. You would have like similar microbiome. So if you're in a situation that, massive antibiotic use or, huge disruption of your microbiome, maybe fecal transplant is like a good option, except with us, it's not widely spread as, we want to be made
Yeah.
or safety of it.
I love that you brought that up because you obviously did your research on that. So, first of all, I was doing some gut microbiome and like microplastics reading, which was like super interesting. I think there's not, really good evidence on it besides that it does cause disruption, but we're not sure what. But then I was reading that in mice, they actually did some fecal microbial transplant and it restored their, microbiome. Now, there is a chapter in my book where I talk about fecal microbial transplant, FMT. Um, because when I was a fellow, we actually this was like it was only like 5 years ago, 6 years ago, where we were still kind of like people had to take blenders of, poop and kind of like instill it back with their colonoscopy to restore their microbiome. And there were a lot of stories where, okay, well, if you're a person from Colorado, you have to find somebody from
Mhm.
Colorado. And there was one patient who had like a twin who was like, living in their same area. And we were like, okay, this is the perfect example of an equivalent microbiome, but from a separate, healthy donor, like a healthy donor, rather than, one that's affected. There are pills, right? So there are pills. Rebiota came out. But I think eventually that there's gonna be like even more information about this.
That would
Yeah.
that would be super interesting. Is there anything else that we should know about hemorrhoids that we haven't covered today?
So I so we are the hemorrhoid centers of America, and I feel like one of the things that I always find is that people come in for hemorrhoids and they don't actually have hemorrhoids because everything on their butt, is called the hemorrhoid, right? Which is like the only thing we know. And and it's totally fair. Like it's totally fine because that's why you come see a specialist. But we see a lot of other things, and so not everything is a hemorrhoid. And one of the things that drives me nuts is that you go to like a doctor or like an urgent care or whatever, and they're like, oh, you have a bump, it's a hemorrhoid. You get a hydrocortisone suppository. Hydrocortisone suppositories work very well for certain things, like, especially like, maybe like bleeding, like,
Bleeding.
or like high internal hemorrhoids. But they don't work as well for like low hemorrhoids or, for example, like a thrombosed external hemorrhoid, which is outside on the skin. So, the suppository isn't getting anywhere near where it needs to be. So my rule is always see a specialist because if it's been like 7 days and it's not getting better, it's probably something else. The most common things other than hemorrhoids tends to be anal fissures, right? Which is probably like the number one most common thing because people, who are bleeding, they're like, oh, the bleeding stopped, we don't need to go see a doctor. But when there's pain, and fissures are always pain, then they're like, no, we gotta go see a doctor. So anal fissures, anal fistulas, which is like an abnormal tract, that can form because of an abscess. And so then that causes like some persistent draining and sometimes a little bit of bleeding. that needs to be like usually surgically corrected. And then obviously there's, STDs like anal warts, which can be a bump on the butt that, those don't go away with ointment, and sometimes they just get bigger. So that definitely needs to be checked out. And then cancer. Anal cancer is super rare. But I have seen a couple cases where people were like, "Oh, this is a hemorrhoid, but it's been a year and it hasn't gone away." And it turned out to be anal cancer. Yeah. So always get checked.
Yes. 7 days. Okay. Only sit on the toilet 2 to 5 minutes and drink enough water, eat your fiber. And then, like, if you have anything more than 7 days, get it checked.
Yeah, I would say even 4 to 7 days. And if you haven't
So,
pooped in like 3 days, you should start taking something, So if you haven't pooped in 3 days, start taking some Miralax, take some magnesia, because anything past 3 days is outside like the realm of like normal. Yeah.
wow.
It's yeah. I'm always surprised how many people like, are like, "Oh, I haven't pooped in 5 days." 5 days? I'd be so uncomfortable if I didn't poop.
It's insane. I don't think I want to be around that person because their mood must be shitty.
That's not scope by Instagram to say that, but whatever. It is what it is. But that's a really good pun. That was a good pun. So I'm gonna tell you the 4 P's. The P's are on pears, prunes, plums, and usually I usually say pineapple, but lately it's been replaced by prickly pear. Um, these peas will always help you poop. So
High fiber
those
content.
high fiber, high water, and they usually have a lot of pectin in them, which is, soluble fiber, which is good for the digestive system, but also good for cardiovascular health. There's been a lot of research about kiwis. I know people ask me a lot about fruit. Kiwis, papaya, um, the prickly pear is new. I actually have a lot of patients who tell me they eat prickly pear or cactus, and that seems to be, like, from what I've seen, actually pretty useful.
Related to prickly pear, which is a little bit easier to find, is dragon fruit, which is
Yes.
also
Yes.
a cactus and it has
Yeah,
a
correct.
ton of seeds and everything.
Does have it. You're right. Interesting.
And that's
And
really
it's
easy
also called
to find.
the and the other word for it is pitaya. So that's a P as well. I have to add that to my P's.
That's awesome. So peanuts and no P value.
Yep, that's a good one. You got it. Have you had your P value today?
Yes. Um, okay, now I want to talk about your book because
Oh,
I think it's a lot of stuff that we just talked about today.
yeah.
Is already in your book. And I love the name too, Constipation Nation. Tell us about it.
Yeah. So I wrote this book because it was like when I first came into practice, about 8 years ago now, I found myself repeating the same thing, like, 30 times a day, like eat your fiber, drink your water, do your exercise. And then eventually I made like a small little black and white brochure that was like, hey, eat your fiber, drink your water, blah, blah, blah. And then at one point, one of my medical assistants was like, hey, Dr. Farn, you should just like write a book about this because you keep telling people the same thing. And so I got pregnant, and instead of like taking it easy, I was like, I need to do something. So I took a few months off and wrote this book and kind of did a lot more, in-depth research about things of what we usually tell patients, but finding the real answers. Because, for example, we tell people eat fiber, but nobody ever says how much, and nobody ever says what kind of fiber. And so I was like, people would be like, what's fiber? Like, where do I find fiber? Like, does chicken have fiber in it? And I was like, no, yeah, and so I think that's where I learned a lot for myself so that I could continue to help patients even more. I'm like, a surgeon because I like to know everything, but also that I really like to have the answers when people ask me a question, and that was part of the reason why I wrote the book.
Where can we buy that book?
Yeah, it is online. Pre-orders are available now. It's on all online sellers, Amazon, Barnes and Noble. It's actually also available in like New Zealand, Australia, and the UK. If you send me your pre-order receipt, I will actually send you a signed book plate. So, yep, do that, and you can either send it to me with my Instagram DMs or email it to me.
Wonderful. We'll also make sure we list on our website because we have a book page too. I think this would be really beneficial for people.
Yeah. Honestly, I think it's kind of amazing what you do. Like I've seen all your Instagram lives and like not only are you guys doing this like, test, but also you're trying to promote overall health for everybody.
I think it's really important because we want people to ultimately, in order to detox, you kind of have to live a healthy lifestyle.
Mhm.
Otherwise, you can't detox. Not only you detox, you also have to have a body system that can support your detox after you finish detoxing, which
Yeah.
a lot of toxins actually get rid of through pooping. So if you don't have a proper anus and then have a ton of hemorrhoid, you can't poop,
Yes.
pleasant.
100%. Yeah, 100%. So, in the late 1800s, they actually called it auto intoxication, where, people who couldn't poop and were constipated, it was just thought to be all these toxins were still in your system and re-intoxicating your body and ended up affecting like your brain. Like, so people were diagnosed with like nervous disorders, heart problems, fertility disorders, all these things. And it turns out, they kind of poo-pooed, no pun intended, auto intoxication as a theory, but it's actually kind of evolved into what we now know as like the gut microbiome, which I think is insane how everything kind of comes full circle in the end.
Yes. And I also like personally love talking about poop. So when we're like get you on Instagram live, we're like I was like super excited because I had this book, What's Your Poo Telling You? I don't know if you're aware of that book.
Uh-huh.
Written by two
Yeah.
doctors, and that was one of my favorite books for a long time. That I literally order like 10 coffee and then give it to all my close friends and family. Hey, have this when you read this, and then set it in your bathroom so you can check
Oh
your
my
poop.
God. Well, except don't put it in your bathroom.
Read it.
After you finish, then check. Yes, after you finish, you can check it in your bathroom. No, I could probably talk about poop all day, and I literally think about it too much because every time somebody asks me something new, I'm like, huh, well, like we never really thought of that before. Like, why hasn't science answered that question? That's why I love having these talks because I think there's always, more to discuss.
Yeah. Thank you so much for taking the time. And I knew so you have more coming up. And I also would love to have another one just to talk about poop.
We should probably actually just talk about poop. I think that would be. I don't know what you would call it, but
It's hugely important because people don't check, and then it's like it. I felt like that's your first sign of your
yeah.
health that you should be checking
100%.
at the time.
No, and I always tell people like, if you don't think about it, it's probably a good thing, but once you're thinking about it, it's like a little too late? So like prevention is key.
Yeah, absolutely.
Yeah. Okay. Awesome. It was so good to meet you. So good to chat with you.
Thank you so much. And until
Thank
next
you.
time.
Until next time.
Yeah.
Bye-bye.
Bye.